Hello everyone and welcome to this Javik Healthcare video. Today we're going to be discussing the management of patients with pressure injuries. Pressure injuries can otherwise be called pressure sores, bed sores, decubitus ulcer, pressure ulcer, or pressure wounds. So I'm also going to be using this interchangeably. Bed sores are sores or ulcers that occur due to prolonged pressure on the skin, and this usually happens where there is a bony prominence. In most cases, these sores happen in immobile patients due to traction, that is pulling of the skin, friction due to maybe the bed sheet rubbing on the skin harshly, or moisture, and this can be urine, feces, or even sweat. What parts of the body do bed sores affect? Well, again, it happens over a bony prominence and it can start from anywhere in the body. For example, in patients that use mechanical ventilators or intubated patients, right? The sores can even start from the mouth. And patients that use oxygen therapies, it can start from the bridge of the nose. So yes, it can start from anywhere. However, most of the body sides that this pressure sore or pressure ulcer usually occur are the back of the head, the elbow, the back, the sacrum or buttocks, the heels, and even the shoulder blades. Moving on, there are certain predisposing factors to pressure injuries or pressure sores. Number one is age. The vulnerable population, which are the very young or the very old, basically people whose skin are frail. Number two, mobility status. Pressure sores will usually occur often in people who are immobile. So when patients are not positioned properly, or they are not turned frequently, or they're not given appropriate skincare or good nutrition, pressure sores can often develop. Also, patients who have circulation issues or diabetic patients are equally at risk of developing pressure sores. Now, let's discuss the stages of pressure injuries, and there are 4 of them. Stage 1. Here, the skin is still intact, but oftentimes gets discolored. In darker skin tones, you don't really notice this discoloration. However, sometimes it does have a purple or bluish tint. But in lighter skin tones, you notice a reddish or pinkish discoloration, and most times it is warm to the touch. Stage 2. Here, there might be a shallow wound or a shallow sore, and in some cases blisters as well. And you notice that the surrounding skin is also discolored. In this stage, the patient might even complain of pain. Stage 3, there is now an open sore which goes down to the hypodermis. Stage 4, now the ulcer or the wound has penetrated all 3 layers of the skin. We're talking of the muscles, the tendons, the ligaments. Yes, all of these places are affected, and sometimes the patients don't even feel pain because even the nerve endings are also affected. The complications of bed sores can be life-threatening. We're talking of these patients become at risk for septicemia if there is a bacterial infection. It can lead to meningitis, bacterial meningitis. It can lead to endocarditis. It can lead to bone infections like osteomyelitis or joint infections like septic arthritis. As nurses, it is very important that we understand that the whole point of managing pressure injuries or bed sores is to prevent infections, because as soon as there is a transmission of infection, then this patient becomes at risk for complications, which is why our goal is definitely to make sure that we prevent pressure ulcers from even occurring in the first place. Now, let's just say a pressure injury has developed, right? How do you manage it? First of all, you have to thoroughly assess the injury. You should be able to know what stage it is. Stage 1, the skin is still intact, right? Then what you can do is ensure you put barrier cream just to prevent the skin from breaking down. Now, let's just say the skin has already broken down. What do? Wound dressing. Make sure that you clean the wound. There are no debris on the wound because again, this can lead to infection. You can clean the wound using saline. Saline solution is usually, one of the first line management of wound cleaning. Also, make sure that while you are performing this wound dressing, wound cleaning, and all of these procedures, that you are using an aseptic non-touch technique. Now, if the wound is already infected, this is where antibiotic treatment, of course, should be included. Also, because pressure injuries result in a lot of pain, these patients sometimes are equally prescribed NSAIDs or just pain relief like acetaminophen or Tylenol. Now, sometimes there are also surgical interventions for pressure sores. Depending on the severity, if it has gone so deep and affected the bones, the joints, the ligaments, everything, these patients oftentimes may need skin grafting. So again, we don't want it to get to this point, but that is a possibility as well. Why this video is particularly about the management of pressure sore, the whole point is prevention. So this is where I'm going to put the torchlight on, and I'm going to give you ways to prevent pressure injuries. Number one is, because this usually happens in patients that are immobile, the first step is to reposition our patients. Again, it depends on the circumstances of that patient, but repositioning usually occurs anywhere from 15 to 30 minutes and even 2 hours, but 2 hours should be the maximum, really. A patient shouldn't have to stay in the same position for more than 2 hours. So yes, appropriate turning and repositioning of the patient. Number two, when able, sit the patient up, because for a patient who cannot move themselves, right? Imagine that they are constantly lying with their head flat. You already know that they are going to be most at risk for developing pressure sores at the back of their head. And if they're lying by the side, on their ears. For a patient who uses wheelchair, it is important that we provide soft padding for them so that at least it can cushion, their bone against the chair. 4, provide very good skincare, helping these patients have a good wash, a bed bath, and putting moisturizers on their skin. Number 5, good nutrition. I'm going to end this video here. I just wanted to quickly remind us that the management of pressure ulcers starts with preventing it from even happening, because trust me, it is so difficult to manage pressure injuries, especially with the daily wound dressing. I don't think any of us wants that. So yes, let's do our part in ensuring that we protect the integrity of our patient's skin. Thank you so much for watching this video, and I'll see you in the next one. Take good care of yourselves. Bye bye.